The views, thoughts, and opinions expressed in this podcast are solely those of the individual speakers and do not necessarily reflect the views or opinions of any affiliated organizations, employers, or sponsors. This podcast is for informational and entertainment purposes only and should not be considered professional advice.
Hi, Dhiru and Amit, how are you doing?
All right, fine. I just got up. It's a time difference. I think between Kenya and here it's 8 hours.
No,
I
there was 7 hours only.
all right, 7 hours right now. So it's 11 o'clock here in the morning.
Okay, where are you
So
guys based?
so I'm in upstate New York.
Okay,
Upstate New York, right?
I mean, I'm in Kenya right now, but I live in Atlanta, Georgia.
okay, great, amazing. So, we'll start with introductions. So maybe like Dhiru, you can go first, and then Amit, you can introduce yourself after.
All right. So let's see. I graduated from the medical school in Makerere in Uganda in 1972. And then I did 1 year of internship in Machakos. After that I was in Kenyatta National Hospital for at least 7 months residency in neurosurgery, which I quit because I was the only resident and there was nobody else, so I was working 24 hours a day, 7 days a week. So I quit. I gave my resignation and joined pathology department. So I was in pathology for 3 years, and then I gave my resignation because of some discrimination. Because I was brown and a black guy who was junior to me got promoted and sent to UK to finish his master's in pathology. And I was told I should go next year. So I gave my resignation and then moved to States. And I did a residency in internal medicine. And after that, which I finished in 1981, after that, I have been, I was in private practice till 2012. Then I joined a group. So right now, I'm working in a group, but my own clinic. And I now do only 2 days a week. And I take sort of semi-retired, but still practicing medicine. General practice, general medicine with adults.
Okay, great. Amit, do you want to go for it?
Okay, so a moment. My story is a little bit more kind of haphazard. So I did my undergrad in financial economics, and then I went to med school because obviously my uncle Dhuru was a doctor, my dad was a doctor, my cousin's a doctor, my brother was in med school, and it was more for lack of a better idea of what to do with life. So I went to med school, finished that. Wasn't sure what I wanted to do, so I went to academia. Was pursuing a PhD for about 4 years. Then I left that because it was honestly not what I thought academic medicine was supposed to be. Then I went to get my master's degree in health management and went to work for a medical nonprofit for about 3.5 years, 3.5 years, something like that. And it was, again, it almost was unrewarding in the sense of whatever I was doing, developing clinical guidelines for physicians and things like that. Doctors just basically do whatever they want to do, anyways. So you can create these guidelines, do all the research, tell them this is the steps you have to take, this is what you do medicine wise. First, try this, first, then do this, but they'll do whatever they want. So it kind of became unrewarding. Left that, got into wealth management due to my financial economics background. Probably the worst timing in the world to do that because I started it in the beginning of 2020, right before the pandemic, and then the markets crashed. So I had all these people's money invested, and then everything tanked. It was insanely stressful trying to recoup everything. Did that for about a year and a half, and then made people at least 20% return, gave them all their money back, closed down shop, did all that. Then for about a year, I just was like a year and a half. I just was trading on my own, just enjoying life. Got into the restaurant business, opened a restaurant. That was an interesting experience, to say the least. I did that for about a year, and then I closed the whole shop down. And that ended in 2023, I believe. Yeah, ended in 2023, and then since then I've just been kind of trading and relaxing and enjoying life. It's been a chaotic 15 years.
Interesting. So I mean, I want to touch a bit about how like Dhiru started in medicine, but actually, I have a question for you, Amit, because you, I think I get the sense that obviously medicine wasn't something you're very interested in, and then you've gone to pursue different fields after. But do you feel there are any sort of takeaway skills or takeaway knowledge that you gained from that experience that has helped you later on?
Oh yeah, for sure. I mean, the knowledge of medicine's always useful to have because, again, anyone gets sick, anything happens to me, anything happens to friends or family, I have the basic knowledge of knowing what's wrong, what medicines they should take, they shouldn't take, just the general practice medicine. And then I did a bit of dermatology and rheumatology, so I know about skincare, autoimmune diseases, and all that stuff. Um, and you gain a lot of people skills in medicine because you're constantly interacting with different personalities, different people, whether it's patients, nurses, physicians, the administration. You have to talk to all these different people in different fields, and everyone's got different personalities. So you kind of have to learn how to adapt to the person you're talking to. So you definitely gain a lot of communication skills and learn how to develop and build relationships with a diverse range of people. So it's definitely useful. I got a lot out of it, yeah. And it helps later on in life in terms of either just going out and talking to anybody and everybody and making friends and developing business relationships. It's just knowing how to talk to different people makes life a lot easier.
Yeah, absolutely. Very interesting. Great. So Dhiru, just want to go back to you a bit. So I want to you to talk a bit about so when you first came to the States and pursuing that field of medicine. What year was that?
Yeah, that was 1976, Christmas Eve. That was the last day before my green card was going to expire. So that's when I entered America. And then once I got to States, I didn't have a residency yet. So I was staying with Amit's dad in Jeffersonville. And then I was working in the emergency room for a while before I got my residency, which I got in 1977. So I had to do 3 years of residency in internal medicine. Then I had to apply for my license to practice, which I got. And then soon after I finished my residency, I started. Well, the hospital wanted. The, it, I was going to start a practice in a rural area, small area where there was shortage of doctors, and so the hospital was willing to open up a office space for me, pay the rent, and staff and furniture. That was one hospital in that area, and there was another bigger hospital nearby. The location where I was going to start the practice, uh, people preferred to go to the bigger hospital because there are more specialists over there. So I didn't take their uh, guarantee. I just said I'm going to start my practice on my own. So I started my practice on my own with from a rented house in the basement initially. And then winters were bad, so then I moved to the main street in town. and I shifted in one place to another place. I was just starting my practice, so it was hard work because at that time I was also admitting patient to the hospital and running clinic. So, and then there used to be emergency calls, so and weekend calls, and so initially three. Then I built my own building for my practice in the same town, and it was becoming busy day by day. Day by day, it was becoming busy, the practice, because people were going in. So from seeing uh, like 1 to 2 patients a day, or going up to 3 patients a day, then it went to up till 40 patients a day, which was a limit, couldn't handle. So then it slowed down a little bit. I tried to slow down. I was going to get a partner, but then I decided not to. And then I was going to the hospital also. So it was, doctor's life is busy life, because you have to make your early rounds in the hospital, see your patients, then go back to your clinic and do the practice, and then again after you finish the practice you go back to the hospital to round off the patients again, or need to go over the new admissions and things like that. So this went on for years. Of course, I made money, uh, but it was good work. I enjoyed my work. I still enjoy my work. I like to, although I'm working now, just no hospital, just going to the office, which is only less than a mile from my house. Um, I enjoy seeing my patients. They enjoy talking to me, and I stay in contact with the practice of medicine, and so I love my profession.
That's amazing. That's sick. That's good.
Yeah. How old were you at that time when you started your own practice?
Okay, so I was when I started my own practice, 1982. I was around let's see, around 38, 40 years old when I started my own practice. I'm going to be 80. I'm going to be 80 this year.
Wow, wow. And I mean, you said you're doing up to like 40 patients a day. So how many hours a day are you working?
Oh, when I was seeing a 40 patient, I would start by my rounds going to the hospital at around 7 in the morning. So a couple of hours in the hospital, and then 9 o'clock I would start my clinic, and then continue till around 6:30.
Right. Wow, wow. So now you've been working for like 40 years, for more than 40 years.
Oh yeah, I'm working for more than 40 years.
And is that passion still there?
Yeah, because I still love, though everybody wants me to retire now, uh, but at least it keeps me occupied. And there are patients who are still, when I started my practice, private practice, uh, there are still few patients are still alive, and they don't want to see any other doctor except me. Most of them, all the seniors have passed away, and so yeah,
Dude, you're 80. You
sometimes
got
the
to retire at
patients,
some point.
like they know you for so many years, they don't trust anybody else. They want to be with you. They always tell me, please don't retire, please don't retire. So tough decision.
Yeah, nice, nice. So actually, what inspired you to pursue a career in medicine?
Oh yeah, yeah. Oh no, the love of medicine and love of doctor was since O levels. I had that interest in medicine, and I had an interest in either being a doctor or a dentist. So I had that from the beginning. So there was one path. It was the field of medicine I was going to go into. I was not good at maths, So the other subjects were out of the question. So it was field of medicine that I was going to pursue.
Okay, great. So that was a bit of a different story for you, because I think you were saying that it's sort of something you went
Yeah.
into because of, I guess, the lineage. But did you, I guess, talk to your uncle and dad in terms of their experiences and in terms of what you can expect pursuing it academically and professionally?
It was a little different because, I mean, if I'm being honest, I would have pursued other things besides, or tried to pursue other things besides medicine. I mean, I would have loved to culinary school. I would have loved to try to do that. I was fairly really good at golf when I was 16, 17. I would like to try to pursue that as a career path also. But coming from an Indian background, Indian household, that's not exactly an option back then. You it's medicine, law, engineering, maybe business, and that's about it. You don't have support to go into these different fields that are generally not Indian people don't generally go into those fields. So it was more because I didn't know what I wanted to do. Well, what I wanted to do wasn't really acceptable. It wasn't going to be supported, and this was something I knew, something I was raised around. I was always around medicine, so I figured why not try it out. It wasn't from a deep-seated passion. It wasn't from something I knew I always wanted to do as a kid. It was more just something to try out, see if I liked it. And I did. The first 2 years of med school were horrible because it's just classrooms, basic sciences, and doing all that, and it was horrendous. I hated that. But the clinical part of it, I did truly enjoy, and I loved doing that part of medicine. Seeing the patients, talking to them, treating them, figuring out the thing I loved the most was trying to figure out the diagnosis of patients, trying to understand what is going on in their body, and it's like trying to solve a puzzle, which I love doing. That was so much fun. But the reason I kind of hated medicine also is because you spend maybe 5 minutes with a patient and maybe 25, 30 minutes just doing other stuff like admin stuff, writing notes, calling insurance companies, scheduling consults, doing everything outside of actually seeing the patient. You spend maybe 5 to 10% of your time dealing with that patient, and the rest is just other crap. It kind of got frustrating at a certain point.
Okay, right. And I mean, can you talk a bit more about that clinical aspect? Obviously, you said that it's something that you really like in terms of the problem solving part of it.
Well, so medicine is it's not always clear cut and straightforward. It's sometimes more of an art than a science because people who come in sometimes have multiple different issues. So you're trying to balance medicine, like what you're treating them with all their other conditions. And I mean, you see this best in like the ICU, where you have people who are in seriously critical care. They have all these other issues, and it's more of an art trying to balance what you're doing rather than just a straightforward, oh, you have this is what you give them, you have this is what you give them. It's not as clear cut. So the clinical aspect was it was mentally stimulating. Trying to figure out the problem, trying to manage the patient, trying to balance the medicine with the risks and benefits. So that was very enjoyable. That was exciting. That's what I love doing. The other aspect of medicine, which is majority of it, is dealing with notes, dealing with administrators, dealing with nurses sometimes who really sometimes are lazy if they're unionized and don't want to do what you tell them to do. Um, it it just it all the paperwork it just became taxing where you like once I started doing clinicals, I got into medicine. And I was like, oh, this is what I love. Like, it's fun, but it's only a small minority percentage of time that is fun. The rest of the time is just frustrating and annoying.
Mhm. And do you think anything can be changed to prevent this in terms of, I don't know, like tech advancements or just changes in?
From a legislative standpoint and legal standpoint, yeah, things can be changed to make it less or more seamless because it was. I'm just speaking basically in America medicine. I don't know how it's practiced everywhere else, but in America, a lot of physicians I know, a lot what I did, and a lot of my friends who are doctors, they practice very defensive medicine. In terms, I mean, that's why the costs are so high because they will order tests, whether it's imaging studies, whether it's blood tests, what have you. They'll order things that are unnecessary because there may be a 1% chance the patient might have this condition, but odds are it's really not there. But you order all these excessive tests, which cause the cost to the patient and to the insurance companies go up because you are worried that if you don't and say their person does have this, you're going to get sued.
Is that one of the reasons why, like, healthcare in America? Well, I think almost everyone complains about the price of healthcare in America. Is that one of the reasons that they end up doing unnecessary tests?
It's one of the main reasons because certain states have a cap on medical malpractice of how much you can sue, but a lot of states don't.
All right.
So when they file a lawsuit, say you misdiagnosed them or you missed the diagnosis because you didn't run this test, and then later on they find out they have this, then they can come after you legally and sue you.
So see, okay. So
Then you
using
have to go to
using
court.
your points, I want to ask the Rufa as well because you run
Mm.
your own practice, and with your experience, how did you approach that situation with patients? Would you give tests, other tests, or tackle the problem directly?
The main thing is, Amit said, you know, practice in America is more defensive because there are sort of a lot of legal suits. If you miss something, it's drastic. Your malpractice is high. So the overall cost of running an office building is high because you have to have high premiums for malpractice, and then see that now it is become very difficult for anybody to practice solo in America. Once he gets out of medical school and residency, he a single person cannot start a medical practice because the insurance premium, the payment are coming down. Overhead has become high, so you cannot maintain the practice. Yeah, because
But there,
since there is
did you say medical
a
malpractice
private,
insurance is coming
I
down or going
wasn't.
up?
I was just trying to do preventative medicines. I prevent. I just run tests which are supposed to be done. I asked them to go for their screenings, so it was more like a preventative medicine that they should go for their regular screening. You know, which their guidelines are there. At this age, you get this screen done to rule out there's no cancer in the prostate, there's no cancer in the colon. If he's a smoker, maybe suggest quitting smoking, or you can order a low dose CT scan to see. Yes, you order a lot of tests, and the cost is high because everything is expensive in America, and there's a lot of research in medicine, so hospital care and everything is high. Yes, so it is high, but my time as a private practitioner, I was not spending too much time on insurance because my wife was working. She was billing for medical insurance. She would fight that. I would be free to treat the patients. I didn't have those headaches. Right now, I'm in a group. I don't have those headaches. Insurance and everything. They have to do the paperwork. They have to do, I have a medical assistant who does that. And then we have a big staff who does the billing and fighting for insurance. I just go in, see the patient, talk to him, uh, and I spend a little bit more time with the patient than paperwork. uh, because I don't normally now. Everything is on the EMR. The notes and everything is there are no charts. There are no patient charts now anymore. Previously, we used to have a patient chart. We used to document things on the paper chart and everything. Now it's all via computer. So many doctors go with their laptop with the patient, and they are just clicking on the computer, paying less attention to the patient. They're mostly clicking on the laptop, their input, rather than looking directly at the patient or examining the patient properly. I don't do that. I don't go with a laptop. I go myself and I talk to the patient, I examine, I make sure he's taking his medication and make sure then I ordered the appropriate blood test and all that. So once I'm out of the room, then I just put that on my dictaphone and it goes into the patient's chart. So, and the most important thing ordering the test is a clinical history. If you talk to the patient properly and get a proper clinical history, half your diagnosis is there. You may not have to order so many tests. So that comes from and that comes from good medical practice. The main thing is talk to the patient, get as much information as you can, which is time consuming, but your half your diagnosis you can make out from just asking certain questions and your examination. Then you don't have to do extensive tests or anything like that.
I would go with 75% of your diagnosis can come from history and physical without even doing any blood tests or any imaging studies. But there, one question I wanted to ask you, which I don't know if they will, like from when you started practicing and now, like, how has that changed? Do you do more testing? Like, what has changed in the way you practice
Oh, right now,
from
no,
like the mid
right now.
'80s, late '80s
So
to
right
now?
now, my practice.
Because you've been practicing for 40
Yeah.
something
So
years.
right
So
now, I was away. So I was away for 2.5 months. I just came back. So first two clinic days were busy because everybody was waiting to get their physical and everything done. But on a normal regular day, I work from 9 to 5.
no, no,
But the
not that.
test
That's not what I'm
wise,
asking. It's like how you practice. No, how you practiced back in the '80s compared to how you practice now. Is it different?
it's same. There's not much difference. The blood test you order is, when because now my practice is more, well, they have diagnosis and all that, so I'm managing their diabetes, I'm managing their high blood pressure and all that, but more emphasis is in preventative medicine. So they get their physical properly, they get all their routine blood work done properly, then they get their screening done properly. This is how you prevent the progression of the disease. And then the other issue here in America is the obesity, so have to manage their obesity. And then now we have so many drugs available to reduce the weight. So my half of my clinic, I would say 4 or 5 patients I'm treating just for overweight. Uh, and right now I don't have to spend all my time. It's busy. Of course, I have to get their labs, then I have to call and discuss about their labs and things like that, follow-up visit. But compared to what I was right now, I'm taking it easy and I'm enjoying it.
Sorry. Therefore, just one. Let me interrupt one sec before I forget. Regarding the obesity factor, how do you treat these patients? I always see this on actual like documentaries and stuff. I don't or not met someone
I
who has
see
been treated for
now
obesity.
with
I
those
would think it's gym and diet, but
now
from your perspective,
availability of the GLP-1, medicine to which we treat for diabetes in the injection form, which is called Zepbound or Wegovy, Ozempic, and all that.
Those are big.
So it's been advertised. People have been using. It is successful. People have managed to lose 30 to 40 pounds in about 6 months' time with the medication. So everybody is coming in wanting to start on this medication, the people who are overweight, whether they have diabetes or not. So then, of course, you prescribe the medication, they're safe. Um, the only thing is whether it is going to be covered by insurance or not, their insurance will cover it or not. That authorization or prior authorization, yeah, my medical assistant will do that for prior authorization, and apparently they get approval and they start. So those medications are working. The way they are working is, first of all, it keeps you full. You feel you're not hungry, so you're eating less. And the other aspect of the medication is it increases your metabolic rate as well. So those two factors does help in reducing the weight. So yeah, those medications are working for obesity. It's a slow, nothing, fast. This is not like having a gastric reduction surgery or anything like that, but uh,
Yeah,
does.
40 pounds in 6 months is a lot, though.
Yeah, there are
That's a big
people. I've
drop.
seen few people who have lost. Uh, well, just yesterday, the one patient I came in had lost 20 pounds in 1 month. No, not one. 2 months.
Okay, do
Two
you know
months.
any patients
Three
that have?
months.
Do you know anyone that stopped taking that medication after they lost all the weight, and then what happens then?
Um.
Do they gain it
Yeah.
back, or do they have to
So
be on this lifelong?
once they've reduced the weight, and once they don't want to start, and they've completed this course and they stop taking the medication, yes, they have gained weight back. Well, not much, because by that time they got the bodies used to eating less, so they do gain couple of pounds or few pounds. But most of the people I'm following are still taking the medication even after a year, 2 years. They're still on the same dose which they were taking, and the insurance allows them to have it. But there have been few cases which stopped and they were not able to lose the weight like before, but they didn't gain their original weight back where they started.
Okay. And are they able to sort of take it for an indefinite period of time if they want?
Yeah, you take for indefinite period of time. After all, these medications, were meant for diabetes initially. When they came out, it was for treating diabetes, but the side effect is that it also helps to lose weight. So diabetes is a condition which can be lifelong depending upon how severe the diabetes is. So there are people who are completely insulin dependent. They have to continue the insulin forever. They are those type 2 diabetes who are related to overweight or weight reduction. They lose their weight, their hemoglobin A1C comes to control. They don't have to take any medication. So it's not that diabetes medication you have to take lifelong. Like high blood pressure medication, normally you have to take forever. So diabetes is a different situation. Uh, Mostly insulin resistance develops with obesity and higher weight, especially in white and black population. In our Asian population, weight has nothing to do with diabetes. Somehow it's more genetic. So it's not always
But
in Asia.
diet has to play a part in it.
Pardon?
Diet has to play a part in it because the Indian population, their issue is they have low HDL and high LDL.
Yeah,
Well, it's more low
yeah,
HDLs.
they have a high LDL and low HDL. That is not due to diet. So if somebody has high cholesterol, it's not always diet. High cholesterol you can control only 10% by modifying your diet, strict diet. You can only reduce by 10%, not more than that. It's partly the genetic, it's the liver producing it, so you need a medication. So it's genetic. Hypercholesterol is not diet related. It
Wait,
is
wait, sorry.
genetic.
You're saying so it's almost 90% chance from the genetics.
I don't buy that. Diet and exercise has a lot to do with cholesterol
No,
levels.
diet
I mean, yeah,
exercise are not.
there's a
I,
genetic
the
component, but
diet only reduces your cholesterol by 10%, not more than that. Diet is not. There are people who are on a strict diet, who are on strict
yeah,
diet
but exercise also
and
helps reduce it.
repeated their lipid profile after going on a strict diet. Guess what? No change on their lipid profile. Remained the same. So
Hmm.
diet is not that important for cholesterol is concerned. There are people who there are people who have an unhealthy diet and you check your lipid profile and it's perfect. So diet is not
Hmm.
that important in controlling cholesterol because it only
Yeah, but
10%. Most of it is genetic.
but I mean that's if you have familial
No,
hyperlipidemia.
no, just even other hyperlipidemia. It's the liver, produces the. You cannot control your cholesterol just by diet alone. If it is just borderline high cholesterol, yes, maybe you can control with the diet, but that's about it. And you don't have to be on
Hmm.
medication for high cholesterol if you don't have any family history or any other issue, but otherwise you may have to take medicine uh, for cholesterol
So
control.
then, what about when people fast? I've seen a lot of people fasting to try and solve medical issues, and sometimes it works. But from a professional point of view of medicine, how does that come into play, and what are your opinions on that?
About fasting and weight reduction,
Yeah, be it for weight reduction or be it to try and solve issues such as cholesterol, like that.
Fasting does have beneficial
well,
issue
fasting,
benefits inside your
intermittent
body because
fasting does help in reducing your weight. Um, and it is not
I
unhealthy.
mean
It gives you the rest to your GI system, and it does help in reducing the weight. But once you stop doing that, you will put on weight again. So you have to continue with that. There's no harm in it. But intermittent fasting and whatever will not have effect on your lipid profile. But you may be able to lose weight.
intermittent fasting not, but if you do fast weekly or something like that, it does. I mean, there's studies showing that it will end up boosting your metabolism and you'll end up burning a lot more fat
Well,
and it will
there's no
reduce.
correlation between your body fat and your cholesterol level. There's no correlation between your body stored fat and your cholesterol level. Those are two different things. Yes, if your
Yeah.
triglycerides are high and you have body fat, it is maybe related, but not the cholesterol, not LDL. But triglycerides, yeah.
Hmm. Well, I mean, triglycerides are your overall cholesterol level. Hmm.
Yeah, I also want to touch a bit more
Uh,
on the obesity and diabetes part because it's often a big issue in the States. And then, when, from your experience, has it really become a problem? Because obviously you started from the 80s. Was it always an issue? Or is it something that's come about in the last couple of decades?
Oh, no, 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 no. This obesity and all that, and diabetes and all that has not been a recent issue. This has been going on since I started the practice. When I started the practice, it was mostly high blood pressure um, and diabetes and cholesterol problem, and people follow up after having a heart attack and things like that. That was the main practice. So diabetes and all that, it's going on. Of course, the treatment has changed since I started my practice in diabetes. You know, the mode of treatment is then, because we have availability of better new medications to control diabetes, which was not there when I started practice in my 80s. It was just sulfonylureas and metformin, and of course just insulin. But now we have choice of quite a few new medication which are out for treating diabetes. Besides the original, we hardly use the sulfonylureas anymore. Of course, the metformin, and then there are GLP-1 and semiglutamides are injection form. Of course, insulin is there. There is a better management of diabetes with newer medication and preventing kidney disease now. So, yeah, it's a better treatment now for diabetes than when we started in the 80s.
All right. Okay.
But the
That's
rise of all these issues has to do with the quality of food that you also get. In America, it's not clean food. It's very highly
Well,
processed.
yeah, it's a highly
It's
processed
not like it
food.
comes. It's not like it's coming straight from the farm to the grocery store. It's
to be
Yeah,
fair, Amit. What you're
you find
saying is
cleaner
very
food in
true, because
Kenya.
even in Kenya, the same thing has happened. We've seen an increase in cancer rates exponentially because of an instance of unga flour, which is a maize flour, maize meal flour, which is the daily staple food of
Hmm.
Kenyans here, and that is going through such high processing, and there have been cases linked to that and a lot of chemicals in it, and I mean, it shows like the cancer rates are going up like crazy.
so
Yeah,
let me
it's
tell.
in America trying to feed the population and keep the food cheap. You process it. You
So,
have all these GMOs. It,
so
it's
in Africa, in Kenya, I did my medical school from 1967 to 72, and then during that time, and during the clinicals and all that, I didn't see any black guy with a heart attack or heart disease, because at that time, those people were eating simple food. I think it's from time that there is increase of diabetes in Kenya and African countries because of Western diet and processed food, and they are putting on weight. Um, if you look at, I did pathology, I did autopsy, and all that. Uh, the only time I saw a black guy with a heart attack was a cook, who was a cook in with some European. Oh no, he was a cook in a big hotel restaurant, and he was heavy. But the plaque formation in the Maasais, if you see, they don't develop any plaque formation in their blood vessels. At that time, uh, even in their 70s, if you do you did autopsy, their arteries and everything were clean. So diet, yes, it's definitely a healthy diet. It's not processed food, which has increased now in Kenya and everywhere, and so that you're seeing more high blood pressure and more diabetes, which was not there before.
and people
But
living
in
in
in states, it was there already when I started practice.
Yeah, and do you think, I mean, this will ever change? Because obviously all these are controlled by massive corporations. It doesn't seem like anything will actually change on the ground level.
See, it's not going,
well, not in the
it's not going
USA.
to change on
Definitely
the
not.
ground level, because let me tell you, um, it's especially in America, to get fresh food, to get unprocessed food. If you try to look for it, you're going to pay more money. It's not coming cheap. So naturally, the general population can't afford to have a natural food. They have to buy what is ever. And so the processed food is going to be there in their diet. And you can't, it's very difficult to change that. So it's, people are getting more aware of it. it there are people because they want, since they are aware, because they want to lose weight, because they know obesity and health is a problem, with, except for physical problem, it also brings in medical problems, and people are getting aware of it, and so they are more concerned about reducing the weight. So they are in a phase where they want to prevent getting diabetes or high blood pressure. And I've seen this trend more in the female rather than the male population somehow.
Right, interesting. And were there any common ailments of when you started in the 80s and 90s that have become better today, like in terms of issues that the population were facing at that time, which isn't as common now?
Well, when I started the practice, besides being, besides seeing people who are sick with colds and upper respiratory infections and all that, they come in, that seasonal, that comes in. With the vaccination and all that, you have prevented a lot of other diseases like measles, mumps, although there has been an outbreak of measles again here in America because of this guy Trump has chosen as his medical secretary, doesn't believe in vaccines. But yes, vaccination,
No, that guy's a
the
moron. He's a fucking
vaccination
idiot.
does prevent a lot. There are specific vaccinations which are very important, and of course that prevents quite a few conditions. And but as far as new conditions, seeing when I started practice and now, it's still the same. There's not much change. Um, People even will develop high blood pressure in spite of being on a good diet, or as you age you are going to develop because there's a little hardening of your arteries, and your systolic blood pressure is going to rise. Before, they thought 160 over 70 was normal, and now they know that that's still high. At that, when I started practice, the normal blood pressure for elderly people was okay. 160 was okay, which is not there anymore. Any age population, there's no, now that this age population, this is acceptable. Now the aim is to keep your blood pressure around 130, just the upper part and lower part around 80 or 70. So yeah, so that's a little change in treating high blood pressure since I started now, at that time and now. So
So,
now we aim for
But that's a
much lower blood pressure readings than which we take, took granted when we started.
right. So, just to tie
but
into
I
that,
just that's a
sorry, Amit, go ahead.
no. I was gonna say it's a good segue into understanding the politicization of medicine now. How it's not what it used to be, where you practice the way you think based on science. Now it's very politicized, and you can't do the things you want to do for the health and safety of the patient.
See, exactly that. So my question is literally tying into that, where I feel like the pharmaceutical companies surely by now would have the cures, you could say, or much better improvements to a lot of issues or health hazards, you can call it. Whereas I feel like they're
Well,
just because of the money, they're not doing it, or they're not giving it.
well, yeah, well, Rishi, there's no profit in cures. You understand? There's no money to be made in cures. These are private corporations. To keep you tied to a drug and to keep you addicted to that drug to keep you alive is profitable. To find a cure for something isn't.
Yeah, yeah,
Like,
true.
so there's a cure for hepatitis C now, and having that boosted the profits of these companies wildly because again they were super expensive, but you do that, you get cured, then you're not on lifelong medication. So once you're cured, then you don't have to take the drug anymore. So yeah, it was hugely profitable for a few years to do that, and now where's the money? Like they spend God knows what billion and a half to create this drug, and then they make money on it, but then once it's gone, it's gone. Whereas you spend $1-2 billion to create this drug, going through all the clinical trials and failures and setbacks, and then you create a drug to treat this patient, not to cure them.
So so
You
so
just want to
just
treat the
just
symptoms
to
to keep them
touch
alive.
on that, if you want to give the answer, just
Mm.
curious about your opinion on the whole COVID vaccine, how it was rolled out, implemented, and the aftermath of the reactions we saw getting from people who took the vaccines
I
and
mean,
boosters. That question to both of you actually.
it
Yeah.
was again, it was very, it was needed to be rushed because so many people were getting the infection, people were dying, people were having serious issues from getting COVID-19, and the vaccine has by and far been very successful. Yes, some people have side effects here and there, but that's going to happen with any vaccine or any medication. You're going to have some people who have side effects to it. But overall, I think it's been wildly beneficial, and it's a it's a necessary thing. Just like the flu vaccine, the pneumonia vaccine, and all these things that people have to take yearly, it's to prevent from getting sick. Your body creates antibodies to the disease based on the vaccine, and it will prevent you from. It's not going to. It might not completely prevent you from getting COVID-19, but it'll prevent you from having severe symptoms from having it, or potentially dying from it. And yeah, there are going to be new strains of the virus because viruses mutate way faster than any bacteria or fungus will mutate. Viruses mutate very quickly. Again, I mean, I can delve into the Health and Human Services secretary that they put in charge, who's kind of a fucking moron because his idea was with the bird flu going on in the U.S. Right, his whole notion was, well, why don't we just let it run rampant through all these and see what happens, and ones that die, and then maybe there'll be some that'll be immune to it. When he doesn't actually understand science, and birds don't have the genetic makeup to fight this virus. And then if you let it go rampant, it can mutate into a possible form that can cross species and infect humans. But the guy's a moron and doesn't understand science. I mean, he used to. I think he once said, yeah, he used to take heroin back in the day, and that helped him study or some crazy shit. The guy's a fucking moron. But anyways, that's my take on vaccines and preventative stuff. Drew
Yeah,
can give
actually,
his
I want to hear the
response.
Rufus as well. Just curious on your
About
opinion on
what?
that. It's quite
About
interesting.
the COVID vaccine?
Yeah, you could COVID vaccines in general, but you can start off with the COVID vaccine part.
Well, vaccines in general, like you know, for the adults, for the children, of course, they have to get their polio and measles, mumps vaccine to prevent those conditions, and um, then
They should
they
get them.
should
They don't
they
have
have
to
to have it
anymore.
so that it's not they don't get it and then they don't spread it. But the other thing is the prevention is hepatitis B. So you get vaccines to prevent getting hepatitis B. There's no vaccine to prevent getting hepatitis C yet. Um,
Or a
or no, A is there. You have a vaccine for hepatitis A, which is not a
okay.
severe condition. It's just a little jaundice. But you have prevention for
Mm.
hepatitis A and B, but not for C yet. And then for the pneumonia, which is a common pneumonia, pneumococcal pneumonia, you have vaccine to prevent that, plus flu every year because of the mutation. The COVID was something different because it came so fast and people were dying. So they had to make a vaccine so fast to get to the general population. So people were even skeptical at that time that they are rushing to have this vaccine available to the general population without doing studies to see whether it is effective or not. So that vaccine was really rushed very fast. And then the initial people to get that vaccines were the medical profession and first responders, and then after that the general population got advantage. But yes, after the vaccine of the COVID and people took it, yes, the COVID symptoms are less, so it does do prevention in not getting a very severe condition. But now, after the evaluation of the COVID 19 and all that, the mutation and all that, the virus has become weaker than what it was originally. So, people who are even not vaccinated do get COVID, but the symptoms are like a common cold, uh, and that's it. So, but yes, the vaccines do prevent.
Again, I got COVID in 2022. Literally, it was like one day I was fatigued, tired, and all that, and then after that, it was no symptoms whatsoever. I was fine after one day.
So, I got COVID twice. Even after vaccination, I got COVID twice. Still,
Mhm.
it's not that you completely cannot get it, just like flu. Even if you have a flu vaccine, you can still get a flu. But symptoms are mild. So you have, antibodies. So that's why it helps because you're producing antibodies, which helps.
Yeah, I also want to ask, how big is the influence of the insurance companies on this whole system? Because I feel like they stand to benefit a lot from how the whole system works.
The insurance company for which you're talking about, the medical insurance
Yeah,
companies.
yeah, medical insurance. Yeah,
Yeah, the medical. See, the thing, as you know, the medical medicine is very expensive in America. Uh, if somebody doesn't have an insurance, it is becomes very difficult for him to get the medical attention. And if they don't have insurance, it's first of all it's difficult to get medical attention, uh, and they cannot control their medical condition properly because they are not going to get the medication. Now, also on the other aspect is the medicine. Although people have insurance, but there are conditions where the medicines are so expensive or the copay for the medicine is so expensive, and these are important medications they have to take for, let's say, somebody has atrial fibrillation, chronic, and they're supposed to be on a blood thinner to prevent a stroke, and the copay is so high that they refuse to take it. So and then they are at a risk of having a stroke, which, and it has happened. So, you know,
So,
insurance companies the are because their premiums first of all is so high, medical premiums are high, and they don't even do a proper coverage for their problem. They may have a deductible and all that. So yes, different type of insurance,
so,
medical insurance, and everything is rolls on insurance. There are doctors who will not see you until you have an insurance. They will not take people who doesn't have an insurance. They will refuse to see him.
so I can give you an example of this. I had to get an MRI done on my knee. and it was my friend's practice who was doing it. Now, if they went through insurance, they'd they bill insurance more. So insurance would cover only a certain part, and then my portion would be like $1,200 to get an MRI. But if I did it where I didn't go through insurance and I just paid out of pocket, they would only charge me $500 for the MRI. It's a really messed up system.
That is crazy.
And I pay like $400 a month for health
So
insurance.
just in 2006 or 5, I think, when I went to the US, I got a small fever, and I did go to the doc at that time, and I think I ended up paying $300 for a few paracetamols, Brufen, and taking their time, which was quite crazy.
I wanted to ask, like, but from both of your experiences, have you ever had like pressure from insurance companies to push in certain medicines or to give certain diagnoses?
It's not insurance companies that do that. It's the pharmaceutical reps that come into the practice. The drug companies come into the practice. They'll give you all these drugs. I mean, back in the day, they used to give doctors all these perks. They used to fly them out for vacations, dinners, all these kinds of things. Then laws came into place where like drug companies weren't allowed to do that, but they still come into your practice. They'll buy the entire practice. They'll buy lunch for you. They'll take you out to like a dinner where they have a speaker or something, and then they'll push the drugs that they want you to prescribe for patients with certain diagnoses.
That's very movie style.
And then they'll give you vouchers where you can give the patient, you take this voucher, you go to the drug company, you get it free for the first time, or you get $50 off the prescription or something. They give you all these kind of incentives so that you give the patients that, and then once they're on the medication and it works and they want to stay on that medication, but eventually the prices are going to go up on those medications. They try to skirt the rules in any way possible to try to push their drugs. So it's not the insurance companies that care. The drug companies try to do this. The pharmaceutical reps.
That's crazy. That's crazy. I also wanted to ask,
Yeah.
what are your opinions on America in general not having sort of a universal healthcare system, because they're one of the few developed countries which don't have that, and
Oh, I mean, it's idiotic because so the messed up part is the doctors are the ones that pushed against having universal health care when it was proposed, when they were when the president at the time was trying to tackle healthcare and proposed Medicare and Medicaid. So Medicare is anyone over 65 gets free healthcare through the government or subsidized, like majorly subsidized. They get a
No,
Medicare
it's not
card
a
and the
free.
government pays for.
Amit, it's not free.
It's not free, but it's
Yeah, well,
subsidized.
no. Anybody after 65 gets Medicare. Now, depending upon their
And then the
income,
poor population gets Medicaid.
no, depending upon their income, the minimum they pay is $153 per month. But if you are making more money, you pay it over 300 per month premium. But it is taken out of
For
Social
Medicare?
Security.
Okay. But yeah, so initially when they were trying to roll this out, the president at the time wanted to do universal health care. And at the time it could have worked because the population was, I don't know, somewhere around 60, 70 million for the entire country. Could have proposed this, it could have gone through. The AMA, the American Medical Association, the doctors, they were strongly opposed to it. Because if you have universal health care and if you have the government footing the bill for everything, the salary for physicians and everything is going to go down. Just like in England, physician salaries are not high.
Yeah, that's a good example.
And in the US, as soon as you finish residency, you're making minimum probably the lowest paying job is probably a pediatrician. You're making $160,000, $170,000 a year. But if you specialize, you can make north of $600,000 a year. Yeah, I mean, if you specialize into say plastic surgery or orthopedic surgery, you can make $1 million a year right out of residency. But like I'm saying, it's wildly different. Like ER doctors who just get out of residency, they're just practicing for like 6 months. They're making about $50,000 a month,
Um,
and that's why healthcare costs are so high too.
that is actually crazy. Rajat, just before you just for the refor before you enjoy your breakfast, and since we're on the topic of food, I wanted to ask your opinion on supplements. Supplements meaning for the gym industry, be it creatine, protein powder, those types of things, multivitamins, calcium tablets, BCAs. What is
Right.
your opinion on them?
Well, see, the thing is, if you
Oh,
are having, like, it's different when you are into that gym business and when you want to build up your muscles and all that. Of course, then you need more protein in the form of creatine to develop those muscles, and everybody does that. You need that. The supplements, there are supplements wise, whatever you need. If you have a healthy diet on a regular basis, you are getting all your supplements which are essential for your body, your vitamins and calcium and everything like that. Now it's different when you are trying to build up your muscles. um, then you need extra protein in the form of creatine and all that. But as long as your kidney function is fine, there's no harm. If you have a problem with the kidney problem, then that should end
so
it.
creatine's not
Huh?
protein. Creatine's not protein.
Yeah, it is a form of protein because it helps
I mean,
with
it's a
the
form of
muscle
energy
mass,
boosting.
build up of muscle mass. And so
Yeah.
the supplements, for somebody who wants to do it, it's fine. As far as other supplements are concerned, calcium um, and vitamin D, somehow there are people who lack in vitamin D somehow. So it is important to get the vitamin
Well,
D supplements. The rest of the
also,
vitamin C,
vitamin
as long
D.
as you are having your fruits and all that, you are getting the rest of your vitamins. And then you don't have to do extra supplements in the form of medicine.
I mean, vitamin D is thought of more as a hormone now than a vitamin
Yeah.
in circles. But Rishi, if you want to talk about this sort of stuff, supplements and adding like testosterone and different additives to your diet, one of my friends, he's an ER physician. He has a company that basically does this. So one time in your podcast, if you want to just focus on
Yeah,
this stuff,
definitely.
I can ask him to come on, and he literally has a company, and that's what he
Honestly,
does.
that would be good because
Like
it's a
he
massive topic.
creates
It's a
these
massive one.
regimens with like testosterone and all this stuff, and like individually personalizes it to the person to give them what they need after doing like a series of blood tests to figure out what you're deficient in, what you can boost, and
Because
all that
honestly, the
stuff.
whole entire hormonal sector is
And
massive. The hormone boosting tablets, the
yeah,
testosterone injections, all of that stuff people are taking nowadays. So that would be an excellent
yeah,
one.
I'll give you his Instagram thing, and then you can look at some of his videos, and then once I'm back in Atlanta, I'm going to see him anyways, and then I can ask him if he wants to come on just to talk about this stuff. He's very knowledgeable and he knows all this stuff. So that's what he does on the side. He's an ER doc, but that's what he does on the side with his company.
Just one quick one from me.
That can be like,
As they say, doctor's time is very rare. I don't know if we can do the rapid fire questions, but let me leave it to Rajat to
yeah.
set the setting.
Yeah.
I mean, I'm free.
Yeah, I
I'm
mean,
here, so
I don't
it's
have
up
any
to.
other questions from my side. So Rishi, if you want to go ahead with the rapid fire, we can.
So just therefore before you leave, we just have three questions each for both of you, not regarding work, not regarding your expertise, just some nice questions ongoing. I think I want Rajat to ask Amit. I will ask therefore the three questions. We can alternate. It'll be interesting. Rajat, you can start.
Okay, I'm gonna do this for you. If you could meet any three people, dead or alive, from anywhere in the world, who would you choose?
um, probably be curious to meet Alexander the Great. Uh, be interested to meet Gandhi, and then honestly, I'd be interested to meet Michael Jordan. Seems like a unique personality, and just different people in different worlds, in different eras too.
Very nice, very nice. All right, therefore, on to you. Give us one classic song recommendation that always touches home. You can say for you. that we can share to our viewers?
As what song?
A song, yeah, yeah. Even if it's a karaoke song, something you sing all the time, you know.
Oh, that's difficult. There's so many songs. Um, I can't recall right now which is the favorite song which touches me. Um, Anything which comes, I enjoy the melody. I'm fine, but there's no favorite song as such.
Okay, then give us a genre, a type of music that you enjoy listening to.
Okay, so the type of music I enjoy, really, it's Indian music, and more like a ghazal. I enjoy that.
Ghazal, interesting.
Oh, very nice.
That I would not have
Ah,
guessed.
okay, nice, nice. All right.
Great, great. Yeah, Amit, for you, what's a hobby that you have outside of work?
Mm.
Something you'd like to do in your free time?
No, I mean, I love to cook.
Okay. Do you have a signature dish?
I mean, I made food here tonight for everyone. No, I don't. I don't generally have a signature dish. I can cook anything. I just can't cook Indian food. I've never tried it because it would never compare to mom's food. So I just don't even bother
Nice,
because it's
nice.
never going to taste as good. So
That's
what's
the
the
wise
point?
man's play.
But I could do everything. I could cook any other type of food. Yeah, it's a hobby I have. I love doing that.
That's a nice one.
It's a creative aspect of cooking. It's
And
kind of
and
interesting.
honestly, I'm going to be one of the lucky people tonight who are going to try one of his special dishes. So
Wait, oh, so,
Yeah.
so what have you made actually today for the family?
I made beef burgers with I basically fried up some bacon, minced that up, put it in, then put the beef in, added some garlic, some onions, salt, pepper, spices, made that into patties, and then I made some tilapia burgers. So mashed that up into like chuck, then added celery, scallions, uh, onions, garlic, and then some spices, and made that into a patty. And then I made different sauces, like one's like a twist on a like the Big Mac sauce, and then I made a variation of a tartar sauce for the
I think
fish.
I'm
Wow,
already
that
hungry.
sounds amazing. Yeah, even me, even I'm hungry now.
Honestly, I think the further he went with that statement, I felt like it's like the price was also going up and your hunger was also going up at the same time. That's a good one.
Yeah.
All right, Rufa, question number 2 for you. Something a little bit deep. If you don't mind sharing, how would you tell our listeners here and to us as well? You know, how do you handle or tackle failures or setbacks?
Um, Failure, setback. The best thing is to accept those failures and back up, and then you need to go forward to try to improve your failures. Try harder to overcome your failures. That's about it, but you have to accept them.
Wait, Amit, last one for you. Do you have a favorite quote or a quote that really resonates with you?
Yes, I do actually. Hold on, I got to pull it up on my phone. I want to get it correct. Give me 1 second.
Honestly, after the answer of the food, I'm very curious about this answer as well.
Okay, so this is a quote I read. I was at a temple in India and I saw this and it really kind of resonated with me. So the quote is I don't know who wrote it. It was just written there. It says two things define you: your patience when you have nothing and your attitude when you have everything.
Wow, I love that. That's great. That's really good. Yeah, nice. Yeah. Actually, on the cooking as well, another.
Oh, also I have another quote. I have the second quote I have is it's from I think it's Nietzsche who said uh some variation of true knowledge is knowing that you know nothing. Because in the entire span of all the knowledge in the universe, you might know a grain of sand on a beach.
Facts.
That's another one of my favorite quotes. Okay. You wanted to bring up cooking?
No, yeah, because on that I just remember another quote related to cooking from the movie Ratatouille, actually, which was anyone can cook. So
Yeah.
I just wanted to bring that up as well.
That's an interesting one. I don't know about the after effects of that, but it's a good one. All right, therefore, just let's end the last question with a bit of a fun one, a good trip down memory lane. What's one of the best travel destinations you've been to? If you don't mind sharing a little funny story about it or a nice moment.
What? I didn't get the question. The funny?
No, what's one very memorable travel destination you've been to? If you don't mind sharing, what was very interesting about it that made it so good?
The travel destination wise, I think the best one was Bali. The reason was it was very scenic. People were very friendly, and when you wake up in the morning, they do their puja and they burn that incense. You can smell that all over the island. And the guide who took us around to see Bali was a very nice guy. So that's one of the best memorable uh, place I have been to. The other memorable thing which happened was when we were, 18, 19 years old, and we were in a Tanzania trip, and the rhino overturned our Land Rover. That's
No,
Wow.
God.
Okay,
another
that
exciting.
is.
Oh wow!
You must have been enjoying the thrill of that despite the fear.
Yeah,
The driver was still in the Jeep. Their guy, the
yeah.
driver, was still in it
The
when it
driver
flipped
was
over.
in the no, the driver no, guide was in the jeep.
Oh, the guide. Sorry.
We were outside. We were teasing the rhino, and the rhino came chasing, running, and it overturned the Land Rover. But we were lucky. We were outside.
The guide
that
wasn't
that's
so
like
lucky.
that's like one of those phrases. Don't poke a bear.
Yeah.
Yeah.
Oh man, but I think that's excellent. I think that's definitely it for me. Before I hand over to Rajat, honestly, thanks so much. I've learned a lot, like a lot, and the many topics it'll be good to discuss in future that we can touch on. And it's been fun. It's been a good one.
Yeah, I agree. I mean, thank you both for your time and for your knowledge. It's been truly, I mean, very educational for me and Rishi as well. Hope you guys enjoyed it as well.
Yeah, that's good.
Amazing, amazing. And to everyone listening, yeah, hope you guys enjoyed it. And yeah, thanks. We'll see you in the next episode.